Hi, my name is Christian. I suffer from Pectus Excavatum. Tomorrow is my surgery. I'm getting the Ravitch procedure. Pretty anxious to get it. A little shaky, but I'm ready. I'm really excited. So, for about a year now, that light is flickering. You see that? For about a year now, I've suffered from I guess my body has grown through puberty a lot faster, and I've always pretty much had it throughout my whole life. But when I was about 20, 21, it got increasingly worse. Running became hard. Anything exercise induced was difficult, especially cardio. So ultimately, I got some insurance and I started making doctor visits and trying to figure out what was going on with me. I pretty much had an idea that I had, Pectus excavatum. I grew up with this throughout school and pretty much my whole life. But kind of went from there. Started out with an EKG and an echocardiogram and a stress test. I did awesome with the stress test. I worked out 5 days a week. I'm 22. I don't smoke. I don't do drugs. I'm pretty healthy. And then I think I did after that a CT scan, and that revealed obviously that there was a lot of pressure on my heart and my lungs and things of that. So anyways, finally I got a referral to a thoracic surgeon. Dr. Kogan at Emory here in Atlanta is going to be my surgeon. From what I hear, he's the best in the country. He specializes in heart transplants and actually infants, which is I guess harder. But he's taken me on, which is I feel very confident in his ability, and I'm really blessed to have him as my surgeon. Pretty much had my pre-op today. Did blood work, did another EKG, did another CT scan. Kind of just went through the whole, how the procedure is going to go and what to expect and things of that such. So I don't know what my Holler index is. Obviously it was enough to, recommend surgery for it. So I'll show you what I got. So as you can see in my chest, there's a little bit of a kind of a concave right here. Straight on, you can kind of see it. Some people think it's nothing, but if I was like to turn to the side, you can see how my chest goes inward, my rib cage pokes out. It's pretty much the most common symptom of it. The reason that these rib cages poke out is because there is, and I just learned this when I met with my with Dr. Kogan about a month and a half ago, which I couldn't find this anywhere on the internet. So ultimately, the reason that your chest goes inward is that there's inflamed cartilage, there's excess cartilage, and so it either goes out like a bird chest or it goes in like a funnel chest. I obviously have funnel chest or Pectus excavatum, and ultimately what they have to do is they have to go in and they have to remove cartilage from about here to about here, and they're going to remove that cartilage. They're going to break the breastbone. They're going to, before they even do that, they'll move the muscles out of the way. They don't have to do any cutting of the muscles or anything like that. And so they're going to break the breastbone, remove the cartilage, and then they will bring the breastbone up. They will put a plate on it. A lot of times people use metal plates and they get them removed. In 2015, they have, like a mesh plate. It'll pretty much dissolve. It'll become, a part of you, and it'll also dissolve away. So I won't have to go back to get a bar out, which is awesome. So anyways, they'll bring that up, they'll remove the cartilage, and I think it's about 5 tubes is what he said. He said one drainage tube under each tit, pretty much, and then I'll have 3, J drains, as I think is what they call them down here. I know that's gonna be weird, waking up like the Matrix. So I don't know what to expect. We'll see what happens. So that's pretty much what's up. I'm gonna make pretty much a journal of pretty much all my days. I've seen a lot of people's on YouTube and across the world, and some of them were really helpful and really good. Some of them were almost worthless. So I just wanted to make one, see if I could do a better job. Again, this is what we got. This is my before shot. This is me as normal as I can be. And I have surgery in about, I'd say it's about 9 o'clock now. Surgery's at 5:30 in the morning. So I'm probably gonna wake up about 2 or 3 if I can sleep tonight. And, you know, kind of hope for the best. There's a lot of trust in one man's hands, so I'm excited. Yeah, thanks for watching. I'll keep you posted.